Now, from CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning and welcome to Facing South Florida. I'm Eliott Rodriguez in this week for Jim DeFede. In the past 10 days or so, we have seen a significant jump in the number of coronavirus cases in Florida as the state continues on the road to reopening. The recent spike has been blamed on increased testing, the reopening of businesses, and the ongoing protests over police abuse, which have brought out thousands of demonstrators. As for community spread, that depends on who you ask. In Miami-Dade, the county with the most cases and deaths, Mayor Carlos Jimenez says some people are getting too comfortable and not taking the virus seriously. Mayor, do you believe that Florida has the potential to become the next epicenter of this coronavirus pandemic?
I mean, there's always a possibility, but I don't think it will be. I think that Florida has a lot of things going for it. And so, no, I don't believe that Florida will be the next epicenter.
Well, let's hope the scientists who are saying that are wrong, but just in case they're not, what are we doing to prevent that from happening?
Well, I've already started a program of more enforcement. I've spoken to my medical advisors today, and we are going to be, I've already given the orders for the police department, our inspectors to go out and enforce our social distancing, our masks, wearing indoors. I noticed that there have been some lax enforcement on the part of some business owners. We are not going to be educating anymore. We're going to be those businesses that allow their patrons to go in without masks, without practicing social distancing, will be shut down. And so now the era of education is over, and now the era of enforcement is upon us.
Well, give us an idea of how this enforcement is going to take place. Will police officers be out there on patrol? Are you going to be taking police officers off other duties in order to enforce this?
Yes, we will be. And well, we've already done 380,000 inspections in the last, 2 months with the police department. It's part of their duties. And, what's more important than safety and the life of our residents. And so they'll be focused in for the last 2 weeks, 2 or 3 weeks. We've been, they've been diverted from with the protests and all that. And so now we're going to be refocusing our efforts on on enforcing the rules. And if we enforce the rules, if we take personal responsibility, then we can continue to keep this contagion low. Right now, we're still at the 14-day average is still on percentage of positives is still below 10%. But we did see a couple of days. We have seen a couple of days where it's gone up to 14, 13%. So that's a concern to us. And so we need to refocus on enforcing the rules, making sure that everybody understands this is not over yet. We have to take personal responsibility, and if we do that, we can continue and move forward.
What do you attribute the high numbers that we're seeing 3,000 cases in one day? Do you think that is because of more testing, or are there other factors in play here?
Look, I've never been worried about the number of folks that come positive because, what's the official number here in Miami-Dade, somewhere around 21,000. But we know there's over 200,000 people that had the coronavirus here because our antibody test, our study showed that we had 8% of our population had already positive for the antibody. So that's over 200,000 people. And so that's never been the issue for me. For right now, the issue that I see is the percentage of the people that are being tested is that percentage above 10%. In the last 3 or 4 days, it is. We've had a slight rise also in hospitalizations. I've always said that we're always looking at hospitalizations. So we're about 640 people in the hospital with COVID-19. We also know that some people are coming in to the hospital for other reasons, not being positive, and then all of a sudden turning positive in the hospital. That's concerning too. And so we have plenty of capacity. We have close to 3,000 empty hospital beds, critical care beds. We have about 500 ICU beds. We have hundreds of ventilators that aren't being used. We're nowhere close to the capacity here in Miami-Dade, but I don't want to get any closer. So right now, all right, we know that we're seeing a little increase. Let's stop it right now. And the way to do that is with enforcement.
What exactly will the police be doing? Will they be giving warnings? Will they be giving people citations, fines? Oh, yeah. What will they do?
And so it really depends. We're going to give the police officers discretion. But we're also telling them, look, we educated a bunch of people in the last 2 months, it's time to stop the education, especially if you've gone back more than once, start giving citations, start shutting businesses down. And so we have to send a message. Look, we're serious about these measures.
In Broward County, the numbers are not as dramatic as they are in Miami-Dade, but there is plenty of concern. I spoke to the mayor of Fort Lauderdale, Dean Trantalis, and County Mayor Dale Holness about the possibility of scaling back some of the reopenings.
Some of the things that we're working on is additional traces to ensure that we are getting to folks who might have been exposed. The county is committed to hiring another 150 in addition to the 150 that's already in existence here. And the health department in Broward County is asking for another 100 from the state. We have to get quickly to the people who are infected now and ensure that they are isolating themselves from the general public. But we must also be a responsibility, each of us, to limit the spread of this COVID-19 virus because all of us are dependent on each other for us to safeguard each other's health. Wearing masks is a very important thing. We've mandated that in Broward County. Social distancing, limiting even now at this point in time, I'd say, because of the uptake that we've seen, going out unless you have to. We don't want to go back to where we shut down the community again. It's bad for the economy. It's not a good thing for us to do. So we must take the necessary measures now to stop the further spread.
Well, how concerned are you about the numbers that we're seeing statewide? You mentioned the few hundred in Broward County, but we're talking about close to 3,000 daily in the state of Florida. How concerned are you about that?
Very, very concerned, because what COVID-19 has taught us is that as humans, we are interconnected. We know the spread started from China, and it didn't take too long for it to get here. So if it's spreading in other parts of the state of Florida, it won't be too long before it gets to us in Broward County. So the entire state actually must take action now to limit the spread. And I know that in some other parts of the state, they're not wearing masks, which scientifically has been proven to reduce the spread of the virus. We must do that statewide.
Would you be in favor of law requiring people to wear masks when they're out in public?
Well, in Broward County, our emergency order calls for that you wear a mask when you're out in public. And there are fines attached to it also, that if you don't have a mask on outside, that you can be fined. But one of the things that I've seen in most instances, people are following that rule, and businesses are not allowing people in without wearing a mask. And they must be very rigid in enforcing that. We've seen some examples of people not following the rules. There was a reported case, actually someone sent me a video of a restaurant where folks had no mask on, and they were pretty much acting as though it was a club. We have no open clubs at this point in time, or lounges or bars, because we know that that's the place where the spread occurs very rapidly.
Well, what about the protests that we're seeing? Even though people may sympathize with the people who are out on the street, how concerned should we be that we're seeing so many people out there, very close proximity to each other, yelling and screaming? Sometimes there's physical contact with people. That also has to have an impact.
It is having an impact, for sure. And I understand the need for people to express themselves in terms of how criminal justice system is being administered and how policing is being done. But we have to be cautious as we go out and express ourselves and let our voice be heard on the reforms that are needed in our criminal justice system.
Mayor Trantalis, thank you so much for joining us. How concerned are you at the spike in coronavirus cases that we're seeing in South Florida, but especially in the state of Florida with these extraordinarily high numbers?
I think we're all very much concerned, although we did anticipate an increase as a result of the opening of restaurants and various other amenities in our communities. Not sure where these spikes are coming from. We're hearing all kinds of reports that they're coming from certain places like nursing homes and other places of high risk. But the reality is it is increasing, and we are concerned about it. And it was a balance we sought to achieve by trying to allow people to get back to work, get back on their feet, at the same time understanding that there would be some risk going forward. The good news is, as I understand it from listening to recent medical experts, is that the intensity of the virus has been weakening. We see fewer deaths, we see fewer people on ventilators, and that the virus is in fact mutating itself weaker and weaker. So it's a difficult thing to really put your finger on, but we're going to do everything we can as a community to try to minimize the impact of the virus.
Mayor, based on your conversations with these experts that you're talking about, do you buy this argument that the reason we're seeing more cases is simply because the state is testing a lot more people?
Well, certainly the testing is increasing, but also the increase in the percentage of new cases is increasing. While we may be increasing the number of new tests, the rate of infection has also increased. In fact, in Broward County, it went from about 2.5% to a little over 5%. So that argument really is not sufficient. However, it's still well under the 10% that CDC used as a guideline for originally allowing us to open up here in South Florida.
Well, where do you stand right now on the possibility of scaling back some of the reopenings that we've seen?
I think it would be premature to scale back anything. I don't think the governor or even the county administrators, certainly our city, is not interested in scaling anything back right now. I think we're just adjusting to the new protocols. I see people wearing masks and gloves, especially in our restaurants. People are pretty responsible, and I've seen it across the board. So hopefully we can achieve a certain level of acceptance, and I certainly hope that those who are infected with the disease will recover quickly, and we can be able to move on with our lives.
Still ahead on Facing South Florida, racism in America and police reform. Washington is taking notice, and so is South Florida. I took part in a virtual roundtable hosted by 2 members of Congress from South Florida. I'll share what we talked about next.